Welcome to Standard Precautions and Infection Control in the School Setting, developed by Karen Blakely, RN, BSN, Special Education Nurse, Hall County Schools. Universal precautions were developed by the CDC in 1985, mostly in response to the HIV epidemic, implementing standards to prevent transmission of HIV/AIDS and hepatitis B, as well as other bloodborne infections for the protection of everyone. In 1996, the CDC expanded these safety measures for infection control and labeled the term standard precautions. Standard precautions apply to the care of everyone when there is a risk of potential exposure to blood and all bodily fluids, with the exception of sweat, even if blood is not visible. Blood and all bodily fluids should be treated as if they contain pathogens. So, what are bloodborne pathogens? HIV, hepatitis B, and hepatitis C are the most common bloodborne pathogens. HIV and hepatitis B can also be found in these bodily fluids: spinal fluid, synovial fluid, vaginal secretions or semen, pericardial fluid, peritoneal fluid, amniotic fluid, pleural fluid, and breast milk. In the school setting, the more common risk of contact would be with urine, vomit, nasal secretions, sputum, feces, and saliva. Fortunately, these fluids carry low risk for containing HIV or HBV. However, they are potentially contaminated with other pathogens with the potential to cause illness if exposed. Examples of other pathogens are viruses, for example, the flu or SARS-CoV-19, as well as the common cold; bacteria, such as streptococcal, which is responsible for strep throat, or MRSA; fungus, such as ringworm; parasites, such as tapeworm or lice; or protozoa. An example of an illness spread by this would be malaria. Pathogens or germs are spread through the chain of transmission. Let's take the common cold, for example. It begins with a reservoir: the nose, mouth, saliva, nasal secretions, or droplets. The common cold is the infectious agent. The cold finds a portal of exit through a cough or sneeze into a hand, and then those droplets are transferred to an object. The mode of transmission: those contaminated hands touch a doorknob, a desk, or a railing. Another person comes along who is now the potential host and touches the infected surface with their hands. The new host's contaminated hand touches their eyes, nose, or mouth, introducing the virus and now becoming a susceptible host. The susceptible host now becomes a reservoir for the rhinovirus and develops a cold, and the cycle continues on. So you may be asking, how do we break the chain of transmission? By being prepared. Anticipate potential contact, use personal protection equipment, hand wash, always hand wash, and employ proper cleanup and disposal of waste. Anticipating the tasks to be done, the risk of exposure, and the personal protective equipment, also known as PPE needed, are keys to success. Gloves should be worn when direct care involves contact with any type of bodily fluids. Always wear gloves when in contact with anything wet that is not yours. Please be mindful of those who have latex sensitivities or allergies, and be sure that you're using latex-free gloves. Also note that students with spina bifida are prone to latex allergies, so please be aware. This slide is important. Gloves should never be reused, should always be changed between each student or task, be removed without touching the outside of the soiled glove, and then disposed of in a lined waste container. Gloves are to be used as a barrier to protect you and the student while performing a specific task. Remove your gloves once the task is complete, and then wash your hands before you pick up a pen to document what you have done. In the event that a splattering of body fluids is anticipated or additional protection is necessary, contact your school nurse, your special ed nurse, or the special ed department if you are in need of additional PPE. PPE is items such as gowns, face masks, goggles, or face shields. We often get asked, what about CPR and mouth-to-mouth breathing? When performing CPR, the risk of infection transmission is small. Gloves are recommended. All AEDs in the Hall County school system come with a breathing mask with a one-way valve. This mask should be used when available to decrease any potential risk. You have at your disposal the most important step in breaking the chain of infection transmission, and that is hand washing. Please do not underestimate the difference that this makes. Hands should always be washed before caring for a student, even if you're going to wear gloves. After contact with any blood or bodily fluids or contaminated garments or objects. After cleaning up spills, even if you did wear gloves. After removing your gloves, before caring for the next student, and whenever your hands appear dirty. We've all become very familiar with proper hand washing steps, but I want to highlight a few key points. Number 1, use warm water and soap whenever possible. Scrub for 10 seconds minimum, 20 seconds ideal, and use a paper towel to dry and turn off the water. Alcohol-based hand sanitizer can be used when soap and water is not available and there is no visible dirt. If there is visible dirt, you need to find a sink and use warm water and soap. Be mindful and keep your hands away from your eyes, nose, and mouth. The mucous membranes of your eyes, nose, and mouth are a portal of entry in the chain of infection transmission. This is not a step of the standard precautions, but it is a step for personal infection control. So let's talk about diapering in the school setting and applying infection control principles. What do you need to remember and implement when diapering in the school setting? This poster will be made available to post in all changing areas. Be sure to follow the steps. Prepare the space and your materials, clean the child, remove the trash, replace the diaper, wash the child's hands, clean up, and then wash your hands. It is unlikely that you will have disposable changing table liners in your schools. So it is important to clean the entire changing surface after every use, in addition to cleaning all used surfaces after assisting a student with toileting. Proper disposal of body waste is another important step in infection control and to protect your custodial staff and other students from unnecessary exposure. If you are dealing with a student who has toileting needs, a diaper genie for proper disposal of soiled diapers should be provided. Urine, feces, and vomit belong in the toilet. This includes emptying catheter bags of urine before disposing of the bag in the trash can. Spills do happen. For small spills, clean up waste with paper towels and use approved disinfectant cleaner. For large spills, consult your custodial staff for assistance. Contaminated supplies, such as but not limited to gloves, diapers, sanitary napkins, Band-Aids, and catheters, should be placed in a plastic bag and tied. This bag should be put into another bag, tied and sealed before going to the dumpster. Trash cans used for bodily waste need to be labeled. A handmade sign or label will work. This alerts your custodial staff and others who work around this area. Clothing contaminated with blood, urine, or feces needs to be wrapped securely and returned home to be washed. Do not wash or rinse clothing soiled with blood, urine, or feces in the school setting. Return the soiled clothes home with the student. This is all part of minimizing exposure to germs which potentially could cause an illness or disease. So, what happens with accidental exposure to blood and body fluids? Accidents do happen, and accidental exposure to blood and bodily fluids in the school setting is possible. If this happens, wash with soap and water right away. If eyes or mouth are contaminated by a splash or if broken skin is contaminated, wash the area and rinse the area with soap and water. And the same applies if there is a cut or needle injury. Wash with soap and water. What about biting incidents? For a student to student bite or a student to employee bite where there is broken skin and or bleeding, refer to your school nurse, scrub and rinse with soap and water, notify the administrator, contact the parent when necessary, and complete a student accident report. Advise parents to always consult their pediatrician for guidance regarding any necessary treatment measures. If you are a Hall County employee and are bit by a student where there is broken skin and or bleeding, you will follow the same process, as well as you will need to complete an accident report and see your workman's comp liaison at your school for instructions for a referral to the appropriate provider. Pregnant women are at no greater risk than other employees as long as appropriate precautions are observed. If there are ever any concerns, it is best to consult your obstetrician or other healthcare provider. Standard precautions were created to protect everyone from the risk of potential exposure to blood-borne pathogens. Standard precautions are based on the premise that anyone can potentially be infectious. Therefore, all blood and body fluids are treated as if they contain pathogens. Ways to avoid contact with body fluids: anticipate potential contact, wear appropriate PPE for the task at hand, wash your hands, and properly dispose of waste and contaminated materials. Hand washing is the number one most important activity to decrease the spread of all kinds of infections. Whenever there is a concern following an accidental exposure to blood or body fluids, contact your healthcare provider. Follow Hall County School guidelines for completing an accident report and seeing a workman's comp provider when necessary. Additional resources are listed here. Thank you for your time.